Bialosky and the other one which are really important. Bialosky especially have done lots of study and research. I read 3-4 of them and still I was searching, they still come on, so I have not studied the other one, but there are lots of really good research which you can in-depth your knowledge about the effect of manual technique, okay? Now, the technique, as I mentioned, we have mobilizing, gliding, friction, traction, compression, stretching, facial release. So we're going to practice all of this. Now, we want to see how the manual technique does help. What is the mechanism behind this technique that's been for thousands of years, from massage or certain simple things amongst the normal people. But now we want to see what the evidence say, what is really behind this technique, how when you do friction, for example, that can get better, okay? Is the most difficult part of manual technique, in my opinion, is this part, the mechanism. Now, again, you can refer to those authors that I just named. One of them is the mechanical input stimulus. Now, how does this work? When you do speak about biomechanical effect of manual technique, as I said, it's very extensive and really need in-depth knowledge. But first of all, it's transient. When you do one pressure point, it's just for a few minutes, or maximum the effect is for a couple of hours. So it's not long-term effect. So therefore, it makes it difficult again to research this, okay? Because it's just, you do it a few minutes, that's it. So you don't have a long-term situation to know what exactly is happening. And the other one is changes not identified. Because when, let's say you do rub someone's back, there are always some changes will happen that still you are not aware of that, and researchers still has to focus on that. And the other one is the areas that as a practitioner we work on it. Okay, someone comes with shoulder pain, and even if you are really good in your diagnosis process, still you might not be able to find the right spot and right tissues to manipulate that. Okay, so the specific area still is unknown as well. So depend on how good you are, those factors will be giving you better outcome, of course. The next part is neurophysiological mechanism. This is again a very interesting subject. Hyperalgesia is one of the outcome of the manual technique, which the sensitivity of pain sensor, let's say, will be reduced. And the next factor is sympathetic nerve system activity, which is happening based on those references that I just mentioned. Changes in spinal cord, especially in dorsal horn, which will be one of the important matter again that help with the outcome. And of course, changes in behavior response is another outcome of manual technique. Now, peripheral mechanism is another way that manual technique helps patients. For instance, reducing blood level and serum cytokines that have been proven by studies. And inflammation will be reduced, for instance, by friction, which has been widely studied, this matter. Changes in blood, beta, endorphin, and serotonin endogenous, all of these have been proven that will be affected with manual technique. You have spinal mechanism, which is again a very extensive subject. Rely on the gait control theory. I don't know if you guys are familiar with gait control theory or not. It's basically is discussed. Imagine there is a gate in your spinal cord that sometimes is open, sometimes it's closed. So when it's open, the pain signal, the stimulus go up to the brain, you feel it, but sometimes you can close that. And this was discussed in, I believe Meltzer was it, if I am right, I don't recall the name now, but in 1960, I believe this was discussed. Gait control is very famous, that with manual technique, the gate will be closed, so people feel less pain. Then where I was. Oops, I lost my spot. Okay, yeah, and the other one is ascending stimulus inhibit, which lots of chemical things happen in the body which inhibits the pain stimulus, and also nociceptive signal will be affected, that people feel less pain, and stimulation of proprioceptive is another factor which is very important in patients' pain sensations, let's say, and also neuromuscular response. For instance, patient lie on bed and raise his leg in a passive way, like straight leg raise, but it's a kind of neuromuscular manual technique. And also, again, hypoalgesia and often discharge, which will go through the brain and the spinal cord will be affected. Changes is in muscle activity, that muscle responds different because there are kind of hypertonic situation when the muscle is injured, for instance, and by even simple touch, you can affect that activity. And the last mechanism is supraspinal mechanism, which is again is talk about psychological factor, how people deal with that. Of course, there is some placebo effect. People say, okay, I had such a good hands-on technique and I'm going to feel better. It's again linked to patient's expectation. As you might have experienced, when patient get to the physio room, you tell them to lie on a bed to do assessment, they immediately lie on their front. No one lie in supine position. Believe me, no one. It's been 20 years. As soon as I ask patient get on the table, they lie down and say, oh my God, that feels good. That's patient expectation has so much effect on manual technique. And the next factor is descending inhibition. Again, is there are so many things happen in the body that inhibits the pain and some other reaction. Changes in opioid system and dopamine production, again, has been proven by studies that help so much with manual technique. Now, this is a comprehensive model of the mechanism of the manual therapy, which I was just referring to. It's a very interesting model. I would ask you please look at this. It's in the reference list. It gives you so much. Basically, this model is being created that if people or other researchers gonna study manual therapy effects, they follow such model.